So, a really cool feature on our app, if you haven't checked it out yet, is our drug discovery, or basically our drug library. So, when we click on this, we have these separated for you guys, but there's tons of really cool information on these and a bunch of different drugs. So, today we're going to actually check out norepinephrine or Levophed, which I know all of you guys have probably given this drug. But what's cool about this is we talk about why we actually give it, right? So, kind of the forms of shock that you can give Levophed for. We talk about typical dosing that you can see. The other awesome thing we talk about is the mechanism of action, how that's actually going to cause the hemodynamic profile or what that's going to do to our hemodynamics when we give this drug. And then, most importantly, right, are some pearls that the CCRN exam really likes to test on. And then we even break it down farther. We're going to give you some nursing considerations, things that you actually want to monitor for when you're looking at this drug, how it can be administered, right? So, can it be given through a peripheral IV or does it need central administration? And then on top of that, we're going to talk about the antidote to give if this actually got outside of your veins, right? Because that can cause a major problem, especially with pressors. So, my little pearl for you guys today for Levophed is going to be how Levophed actually works. It actually stimulates two different types of receptors. So there's alpha 1, and these are found kind of throughout our vasculature or our blood vessels. When those are stimulated, they cause vasoconstriction or clamping down, right? So tightening of those vessels. And really what that leads to is an increase in our systemic vascular resistance, right? And if I increase that systemic vascular resistance, I am essentially increasing the pressure within my vasculature. Now that is going to lead to an increase in our blood pressure. And that's why we see that when we give Levophed. It's a pressor. The other thing that it does is it stimulates beta 1 receptors. Now, these receptors are actually found on the heart. So, when I stimulate these, I'm going to have an effect on the heart, which makes sense. That's where those receptors are. But what happens is I get an increase in contractility or an increase in inotropy. So, you'll see a better squeeze when we give Levophed. So, if I squeeze, I pump more blood out, I get better cardiac output. So this is actually what we're seeing in patients when we give Levophed. And one of the reasons that we give it is because it works on multiple receptors in order to increase our cardiac output.